TB is a serious disease that can cause a person to become very sick if not treated with medicine. It usually affects the lungs, that is, pulmonary tuberculosis, but other parts of the body can also be affected, extrapulmonary tuberculosis, such as the brain, lymph nodes, the kidneys, bones, and joints. If not treated properly, TB can be a fatal disease. How can anyone get TB disease? TB germs are passed through the air when someone who is sick with TB disease coughs, laughs, sings, or sneezes. If you breathe air that has TB germs, you may get TB infection. This means you have only dormant or sleeping TB germs in your body. These dormant germs are not making you sick, and you cannot pass these germs to anyone else. If these dormant TB germs in your body wake up and multiply, you will get sick with TB disease. TB can cause death if not treated with medicine. Once you have TB infection, you have a higher chance of getting TB disease if you have HIV infection, if you have been recently infected with TB, that is, in the last 2 years, if you have other health problems like diabetes that make it hard for your body to fight germs, if you abuse alcohol or inject illegal drugs, or if you are not treated correctly for TB infection in the past. How is TB spread? Do you know? Babies, young children, and elderly people also have a much higher chance of getting TB disease if infected with TB germs. This is because their body defenses are not as strong. You cannot get TB germs from sharing drinking containers or eating utensils, smoking or sharing cigarettes with others, saliva shared from kissing. TB is not spread through shaking someone's hand, sharing food, touching bed linens or toilet seats, or sharing toothbrushes. Some signs of TB disease are a bad cough that lasts 3 weeks or longer, pain in the chest, coughing up blood or phlegm from deep inside the lungs, weakness or feeling very tired, losing weight without trying, having no appetite, chills and fever, sweating at night or when you're sleeping. The aims of TB treatment are to cure the patient of TB and restore their quality of life and productivity, to prevent relapse of TB, to reduce the transmission of TB to others, to prevent the development and transmission of drug-resistant TB. How is TB disease treated? You will start off with several TB medicines. You will need to take your medicines the right way, just as your doctor or healthcare provider tells you. You will need to stay on TB medicines for at least 6 months. Follow these medicine tips. Take your pills exactly the way your doctor tells you. Take your pills even if you feel well. Talk to your doctor about any side effects from taking the pills. Your doctor has tips to help you take your pills. Other things you need to follow. Wear a special mask if your doctor says it is needed. If you're not wearing a mask, cover your mouth and nose with a tissue when you cough or sneeze. Keep windows open in your home, if possible, until your doctor says you cannot pass TB germs to others. Don't spend time in closed spaces with others until your doctor says you cannot pass TB germs to others. Remember, TB can be prevented, treated, and cured. Please visit India Medical Hub and share this video to help create awareness.